Hi, I'm Dr Felicity and I'm here to talk to you about the different types of filler that we use over at SkinViva. These are the range of products that we have. They're made by Allergan and it's the Juvederm filler that we have here at the clinic. All of the filler that we use is hyaluronic acid filler. So hyaluronic acid is something that occurs naturally within the body. It's something that we make and break every few days. However, hyaluronic acid filler lasts in your body for a little bit longer, so it means that if you've got any loss of volume or you want to create any subtle little changes, so maybe change the shape of your nose a little bit, things like that, it would actually stay in the body anywhere up to around about 18 months for you, depending on which of the fillers that you wanted to use. They're really safe products to use because they're hyaluronic acid. It means they are fully reversible as well. So if for any reason we had any concerns with the treatment, we could reverse it for you very safely, unlike some other types of filler. What I'm going to do now is just run through the different options of filler that we have, and it's something that your clinician will go through with you anyway. Certain fillers are better for certain areas of the body, so it's really important that you know the difference, not only in the range of filler that we have, but also where we would use the filler. So the first set we have here is the Juvederm Ultra range. This is kind of the original hyaluronic acid filler that Juvederm brought out, and it still remains the industry leader actually. It's one of the most widely used fillers, and it's a great product to start with. It will last anywhere sort of 6 to 9 months on average, although obviously everybody is slightly different in terms of how quickly you break it down, but around about 6 to 9 months is how long it would last. You've got within the Ultra range, Ultra 2, Ultra 3 and Ultra 4, and the difference between them is actually the thickness of the filler. So the Ultra 2 is the softest. That's going to be best for places where it's kind of a fine line, maybe just above the upper lip line, somewhere like that. Juvederm 3, that's a medium thickness one. That's great in nose to mouth lines, mouth to chin lines. Can also be used to give a really nice lip enhancement as well, that one. And then finally Juvederm 4. Now this is your thickest. It's kind of much more structural than the other two products. So this is the kind of product we would use in your cheeks or your chin. And sometimes, depending on the kind of treatment you want to have done, it would mean that you would need to have different fillers. We can't say it's not a one filler fixes everything kind of affair. So if you want some treatment in your cheeks but you also wanted your lips doing, yeah, we would recommend that you would have Ultra 4 and then some Ultra 3 for your lips. So this is what we use for sort of cheeks, and that's where we would go for your lips. Now, Juvederm also have their superior range, which is the Vycross range. Now, it's still hyaluronic acid, but it is a much more sophisticated product than these three, okay? It's a bit like, that's an iPhone 3, this is the iPhone 7. It will still work, your Ultra range, but this is just gonna give you the best result you can ever achieve. On a structural level, a hyaluronic acid is tiny little molecules. Now in here, in the Ultra range, they're actually quite big molecules. So if you were to picture a bean bag, it would be like filling that bean bag with big pasta shells. So it'll fill it, you can make it look okay, and it will do the job, it will have filled your bean bag. But this will be like filling a bean bag with grains of rice. So it will look better, it will feel better under the skin, and it will just give you a much better result overall. Because it's smaller molecules and because it sits better in the skin, it also lasts longer. So all of these products will last you much nearer sort of 12, 18 months plus, whereas these were just the 6 to 9 months. So it's good that it lasts longer. It's good because it gives you a better result, but because it lasts longer, it means you don't have the risk of the procedure every time. So maybe, say somebody has the lips done using the Ultra range, you'll have to have that done twice a year. You have to go through the pain, the swelling, the bleeding. Whereas if you chose Volift instead, you'd only need to have that done once a year. And instead of giving that sort of slightly harder look, it's going to give you a really lovely, soft, supple look to your lip. Broken down in exactly the same way, we have Volbella, which is the softest. That's brilliant for underneath the eye, tear troughs, where the skin is really a little bit thinner and you want a much more softer, supple filler. That's where we would use something like that. Or again, fine lines around the lips, beautiful. It's like putting an eraser on the skin there. Volift, this is a bit like a Juvederm 3, so if you want to have the Da Vinci lip that we do here, this is the product that we would use. It just gives a beautiful shape, beautiful softness to the lip, and enhancing it at the same time. Voluma, this is the one where we would use cheeks, chins. Again, it's more structural, it's the thickest, but it's just not as stiff as your Ultra 4. So again, it was just going to give you a much more natural look. With all of the products, because the hyaluronic acid loves water, and it will draw water towards it over the first few days. So with any filler, you will see an immediate difference, but over the next few days, it will just develop and get better and better and better. Because of the molecules in it, again, this will take water up much more uniformly, and you may not actually get as much swelling as you would with the Ultra range. So that's another real benefit to going for this, particularly in a lip area that we know swells a little bit more anyway. You will see less swelling with this range. In terms of amounts of filler, that's something everybody always asks. Oh, I only want half a mil. Oh, I want a mil. And I think there was a catchphrase, I think it was one of Tim's catchphrases, is it's skills, not mils. And where we put it and how we put it is actually way more important than the quantity that we put in. There are guidelines in terms of, for example, in a lip, it's very unusual that we would go straight to putting in more than a mil in anybody. Some lips can take more than a single mil within them, but because they swell and because each individual site it swells a little bit where the needle has gone in, it makes it harder for us to judge as well. So in a lip, I would never really put more than 1 mil in any one treatment sitting. Wait for the swelling to come down. 2 to 4 weeks later, we can put a little bit more in if you desired. Other places, cheeks, usually around about a mil each side, but again, we can add to that. I wouldn't do necessarily masses all in one go, because if you flood the area with filler, you're not seeing the subtle changes that we're trying to make for you, and you don't get the same end result. So it's much better to almost build the filler up, even if it's in 2 sittings rather than going hugely in 1 sitting. You can use more than a couple of mils throughout the whole face, so I can maybe put a mil in each cheek. I would maybe put another mil within this area here, another mil here, a mil in the lip, and that's absolutely fine. Just don't flood any one particular treatment area with filler. I think any of my clients who come and see me know that I love an analogy, and I think the best analogy I can give you is if you were to picture filler being like a big jar of, if your cheeks were a big jar of marbles and the filler was custard, okay? If you were to pour that custard over the top, it's going to take time for it to actually get all the way through in between the marbles so that it's settling and integrating within your own tissues, which is one of the main reasons why we don't flood an area, because if you just keep pouring custard on top, all that happens is it doesn't sink down to where you want it, it just splurges out over the top. So that's probably the best reason I can sort of demonstrate why we don't flood an area with filler. Like I said, it's buildable, and it is much better to put a good bit in, let it settle, let it integrate, then come back. We're more than happy to see you again, and then add the next little bit in. Out of the 2 product ranges though, again, I would say that your Vycross range is much more buildable. It tends to, because remember I said it's the smaller little molecules, it settles much better, it forms a much nicer, almost blanket layer, so it's easier to build layer upon layer till we get the result that you really want to see. You can still do it with this, and please don't get me wrong, this is still going to give you a lovely result, and we're trained to give you the best results no matter which product we use. It's just that these results will be far superior for you. I think, to be honest with you, that's generally the main things that I wanted to talk to you in terms of the products. So yes, we've got the 2 ranges. We've got the Ultra range, we've got the Vycross range. Ultra range lasts around about 6 to 9 months, whereas this you'll be looking 12 to 18 months plus. Different thicknesses, so 2 then a bit thicker 3, a bit thicker still 4, and similarly with the Vycross range you've got Volbella, a bit thicker is your Lift, and then finally the Luma is the very thickest within that range. It's really good to have a chat at your appointment with your clinician. Just decide between the two of you, what is it you're trying to achieve, what is going to be the best product for the area that you are trying to treat, and have an open discussion about, are you comfortable with that? Yes, let's go for it, and take it from there. So hopefully that was useful.